This is the weekly Health Law News Nugget from Southern Health Lawyers. I'm Rich Sanders.
This is the Health Law News Nugget for the week of October 21st, 2019. Well, News Nugget viewers, it's great to be back in front of you again. As you can tell, it's been a very busy September and October here at Southern Health Lawyers. We're going to do our best to get back on a weekly schedule of the News Nugget. In the meantime, though, the world of health law doesn't stop spinning. It's a very busy couple of days this week with arguments between health insurance companies and the federal government in the federal court system about amounts they're due under the Patient Protection and Affordable Care Act of 2010. First, on October 21st, Monday, health insurance companies were arguing in front of the Supreme Court over payments that they're due under the so-called risk corridor. These are statutory, so going back to the PACA from 2010, statutory allocations that are supposed to be paid from the federal government to health insurance companies to help them subsidize losses that they experience on the exchanges, now called the marketplaces. Well, health insurance companies got together in a class and argued all the way up to the Supreme Court, including oral argument on Monday, that the federal government owes them collectively approximately $12 billion as a result of its failure to pay these risk corridor payments. Step forward to the next date. Yesterday, Tuesday, October 22nd, a different group of health insurance companies was arguing at a lower level court called the Federal Claims Court in Washington, D.C., that they separately are owed $1.6 billion from the federal government under a different program called the Cost Sharing Program. Basically, under the PACA, the federal government was supposed to come in and provide subsidies to individuals through their health insurance companies for cost sharing that's different than the subsidies for deductibles and co-payments that apply in other parts of these insurance policies. This cost sharing component is much less well known and frankly smaller. That's why the dollar amount is only $1.6 billion, but nevertheless important because the judge yesterday in the Federal Claims Court granted the request from the health insurance companies that they be paid this amount by the federal government and left the case open so that each insurance company that's part of this group can submit its individual claim for damages. So, lots of insurance companies asking for money from the federal government to subsidize or support their participation in the exchanges, and all of this in the context of the 7th open enrollment season on the exchanges since the passage of the law. We'll keep you posted on all these developments on the Health Law News Nugget. I'm Rich Sanders. Thanks a lot for watching, and we'll see you next week.